Thank you, Father Zach, and thanks to all of you too for being here. It's so good to see all of you. And for those of you tuning in from home, I'm Marcus Gibson. I direct the Princeton Initiative in Catholic Thought, and I'm so excited to be able to help welcome Dr. Greg Bottaro to campus. Dr. Bottaro, in addition to being a clinical psychologist, is the founder of the CatholicPsych Institute, which is a new project, a new institution designed to bring together the sound science of psychology with Catholic faith and Catholic anthropology in order to help people to truly live out their vocation, to be the people that God has created them to be, which is just such an exciting project to learn about. And we'll be able to hear a bit more about this shortly as Dr. Greg speaks to us about how, as Catholics, we can integrate our faith with psychology in order to grow as human beings. So please join me, all of you, and help me welcome Dr. Bottaro.
Awesome. Thank you so much. I'm really excited to be here, and I miss college. I miss university life. I miss academia. I miss study, and I missed it so much that I was about 2 years ago thinking about maybe going into teaching, and then I thought, well, I don't even know where my CV is or resume. I don't want to start going through job interviews, so I'm going to actually start my own certification program just so that I can start teaching again. And so I left clinical work. I have a team now, the CatholicPsych Institute, and I've been buried in a back closet for the last 6 months, just putting together our certification, getting ready to start teaching again, but just driving onto campus, my spirit just rejoiced. And it was just such an exciting thing to be back into this kind of environment and just to get back to the freshness of pure thought, seeking truth, having goodness as a real goal. And out in the world, as you can see and as you know, it's obviously pretty jaded. So I want to be here for you, and I have some notes and I have some thoughts that I want to prepare, that I've prepared to give you. But I really want to tell you a little bit about who I am, where I come from, what I've done, and then open it up and really kind of dig into some question and answers and see how I can really serve you the best. And that's what I'm excited for. So as Father Zach was alluding to, he met me, I was a Franciscan Friar of the Renewal. So I started off in 2003. I was actually in temporary vows for 3 years as a Franciscan. I was with the Friars of the Renewal in the Bronx, order that was partly started by Father Benedict Rochelle, if anybody knows who he is. If not, you should definitely check out his work. His books are amazing. And also a psychologist who was a priest, a friar, and integrated the faith. So if you're really interested in what psychology as a science has to offer for human development, especially flourishing in our spiritual lives, Father Benedict is a place to go for that. And then I discerned during that time that I was called to married life, so I left the friars before making final vows. And that in itself taught me so much just about what discernment really is, how to really discover our purpose and meaning, and how difficult that really can be. But I left. I went to graduate school. I went to get my doctorate down in D.C. at a program called the Institute for Psychological Sciences. So I have a PsyD from there. Graduated in 2012. Same year I met my wife, and a year before we were married in 2012. So actually, next week, we're celebrating our 10-year anniversary. And so thank you, and we're going to also be, we're pregnant with our 7th child. So soon in December, we'll be bringing our 7th into the world, which is an exciting journey in itself, an adventure. So lots of things that I've gone through, experienced, and brought together in this path. So like I said, just kind of want to share a lot of that with you all so that you can even know where to start if there's anything that you'd like to ask me about afterwards. Hello, welcome. And so we have, this idea of integration I've been obsessed with since my conversion in 2000. I was a freshman at Boston College. My parents had gotten a divorce the year earlier, and I went to school a mess, and I was trying to figure out which way was up, and I was in class with Peter Kreeft. And Peter Kreeft blew my mind open with different ways of thinking about truth, about the world, about how I know what I know, epistemology, all these things. And I was in love. I was in love with truth and with the faith, and I read Love and Responsibility from John Paul II, and I read Love and Responsibility, and I was already thinking about psychology, and I was thinking, if I'm going to be a psychologist someday, this is the manual for marriage therapy that I want to use. And I had no idea that nobody ever used Love and Responsibility for marriage therapy. Like, most people can't even understand it to get through chapter 3. And yet, you know, it's like the most brilliant articulation of how we're made, what we're made for, and how relationships are actually created to work. And then if we know that model, then we know how they're broken. And if we know how they're broken and what they're made to look like and how they're supposed to work, then we can be some part of putting it back together. And maybe it was because my parents had just gotten divorced. Maybe it was because I had that freshness of freshman year of college. I was just open to this reality, and I wanted it. I was hungry for it. And this is where integration started to become an obsession for me. Then I started to learn about St. Francis. I read Chesterton's biography and was inspired. I started discerning religious life, and by the time I graduated, I took a little detour into the Franciscan way of life, but I never really left behind that obsession for integration. And it was this idea that we are a unity of a lot of things, but that we shouldn't be divorcing our pursuit of truth through scientific means from a pursuit of truth through revealed truth. And if truth with a capital T is a unifying source and summit, then every path that leads us to truth should be congruent and at least line up with each other and not be in conflict with each other. And so there should not be any conflict between science and faith and religion. That these things should, if we got religion right, then it should line up with the science. If we have science right, it should line up with our faith. And a lot of times we don't have faith right, and we don't have the religion right. So that's why sometimes the scientific data doesn't look right. But it is not always science's fault. But in our current culture and this postmodern world of relativism and scientism, it is a lot of times science's fault. And so if we look at how to understand that revealed truth should be the mother of all sciences, then we have something to ground our scientific study on. So the science itself, the scientific method, can't be the foundation. It has to be grounded on something else. And so this is where we start to put these ideas together and realize that we should use science, be pulling from the data, but at the same time always have some context that we can evaluate it in and through. So if we look at integration, what is it and how can we use it, we have to see that we are these body-spirit unities. And so right off the bat, we're like off the plane from where science allows us to go, right? So we're beyond the world of observable data. And so we're looking at the fact that we believe by faith that we do have a spiritual life, that we're made for eternity, and that in some way we're going to make sense of our material bodies, but it's, again, not the foundation. And so if we look at body and spirit and we realize that they overlap, then that's where we find psychology. Psychology is this place that actually sits really nicely over both. And one of the things that I've done a lot of deep dive study into the last 20 years is going from Love and Responsibility, then going much deeper into personalism. So is that anything you guys in particular have studied? Has anybody really looked into John Paul II's personalism? So he's grounded on atomistic metaphysics and then going deeper, allowing for the observations of phenomenology and some of these newer things, newer drive of our current culture, looking for the experience of life. What is it to be human? What are we yearning for? What are we longing for? And using that language to articulate also our timeless truths that we have grounded on. And so that phenomenology gives us a description of the inner experience of man, and the metaphysics and that Thomistic backdrop gives us a structural, categorical understanding of everything which is objectively true and good and beautiful. So we should, again, marry these two things together. As John Paul II did, he did this beautifully. And so he describes the person in these metaphysical categories, but with a reverence for the subjectivity and the unrepeatability of the person. And this is where his personalism gives us categories and ways of understanding that really touch the heart of man. And that's why as a, oh gosh, how old was I? It was Paris World Youth Day, which was 1997. So I was 16 years old in the streets of Paris, hearing John Paul II cry out to the crowds to be not afraid, go out into the streets to seek happiness in the form of Jesus. And he says, when you seek happiness, it's Jesus you are looking for. And the way that he could speak and the way that he could hit the heart of what young people especially were really longing for was because he was in tune. He was in touch with the experience of being human, and he was just in it. Like, he would sneak out from the Vatican and go on these like clandestine ski trips to the mountains with friends, and then he literally would hide in the back seat of cars so he could get through the Vatican guards and end up on a ski slope someplace until it was a big problem after an assassination attempt, especially. So not on the ski slope, but in the Vatican. So he was with people, and as a priest before he was a cardinal, he would do these hikes and just be out in the mountains with young people, with married couples, with families. He was just with people, and he understood the experience of being with people. And so there's so much psychology in the work of John Paul II, and it's ultimately people seeking happiness and seeking holiness, but maybe not even knowing it. And so, when you say like, oh, this breakup is killing me, or I'm lonely, or I wish I had more friends, or I wish I would do better, I wish more people would validate me, I wish that my grades were better, I wish I had more prospects for this and that. It's like you're looking for Jesus. Every one of those things, you're actually looking for Jesus. And this is what JP2 had this brilliance to like see through that lens. It's like putting on these lenses, and he'd hear these people, yeah, he broke my heart, and he knew how to listen, and he knew what she was looking for. And he would just talk about the boyfriend and what a jerk he was. But he knew she was yearning for Jesus. And so he would sit with people and walk with people and accompany people and be Jesus to them so that they would meet Jesus through him, even if he never said the word Jesus. And so this is real psychology. In the certification that we're developing now, it's actually a certification for accompaniment, and it's training people how to walk with others who are suffering in any kind of ministry, not even just licensed mental health, but for priests and for campus ministers and for teachers and for even just parents and families. It's because we are all called, this is what Pope Francis is saying now, we are all called to this ministry of accompaniment. But the number one thing that we have to figure out is how to get our own junk out of the way first. And so in our certification, the first quarter of the whole certification, you actually get a mentor walking with you to work out your junk. And this is actually the oldest model of the psychotherapeutic training. This goes back to Freud. You couldn't be a psychoanalyst unless you had an analyst first. You start off in analysis, you work through your own stuff, and then you can actually provide it for other people. And I'm not like a big Freudian, but I do like to throw him a bone every once in a while. He did kind of kickstart the whole contemporary field of psychology, so we got to recognize him and give him his due. And unfortunately, that part of the paradigm has been lost. So now you look out in the world of mental health and you look at master's and doctoral programs, there's no requirement to have your own therapist. It's absolutely absurd. And then you have friends that go to therapists, you go to a therapist, you hear what's going on in therapy, and you're like, how is this therapist life so screwed up? And my friend's not getting helped by him, and I certainly didn't get anything helpful out of those sessions. What the heck is going on? You're like, this field must be totally whacked out. It's like, it's not the field. The field is beautiful. It's science, and faith could actually come together. The opportunity to actually know how to accompany people and bring people to that happiness that they're seeking is astronomical. It's just that it's gotten so distorted and thwarted by postmodern relativism and scientism that it's like there's no way to have any kind of foundation of how to help a person. So what are we doing? What's integration? First of all, if I want to talk a little bit for a minute about what integration is not, because this is also something that I find people are super confused about. If we have this understanding of mental health, and then we see that there's mental illness, psychopathology, that there are distortions in what it feels like we should be living, right? So sadness, depression, anxiety, I don't want to get out of bed, I don't like myself, I look in the mirror and I've got nothing but critical thoughts that are going through my mind and constantly judging myself, all these things. And you look at all this stuff and you just sort of broad stroke it, mental illness, that's not mental health, whatever the case might be. Some of that might be true, but some of that might be not true. Some of that might be biological illness that we can't do anything about. And people think, okay, if this is a mental health issue, this is your fault. And especially when you add spirituality into the mix. And now it's because you're not praying enough. Well, of course you're depressed. You didn't go to confession. Now, side note, always go to confession. And it will always be helpful to go to confession. Unless, of course, you're dealing with scrupulosity. That's another side note to the side note. And scrupulosity will make you feel like you always have to go to confession, but you actually maybe shouldn't be going to confession. So you should have a confessor that is aware of some of these integrative psychological issues. But the point is, you can't just pray away all your mental health issues or problems or discomforts or burdens. And so that's not always the answer. Sometimes it is the answer. It's not black and white. It's not either or. It's very Catholic. It's both and. And so what we want to be able to look at is our perception of what our goals are and how we are seeing this integration and how it's played out so that we can pick out when it's not actually healthy or good integration. So I like to tell a story of Saint Therese. And Saint Therese is one of my favorite saints. And a lot of times, stereotypically, a lot of women love Saint Therese. A lot of men are like, why are you talking about this? They're like, this is boring. She's French. She's flowery. She's like whatever. And you read the story of a soul if you've ever read that, and it is very difficult to get through. But she is one of the most courageous warriors of the spiritual life I think that we know anything about. And if you really go past the surface, the flowery 19th century French surface, you will find that she's a doctor of the church. So somewhere in the wisdom of the church, somebody thought that it was a good idea to promote her spiritual doctrine. And in this world of her understanding the person and the psyche and the spiritual life in light of the psyche, she has come up with what is called the Little Way. It's the spiritual doctrine of the Little Way, which has made her a doctor of the church. So I like to break down St. Therese a little bit. And if you start to really get into what was happening with St. Therese, it's a little bit surprising. So first of all, it's the end of 19th century France, where post-revolution, we have all sorts of postmodern relativism. We have now, from the church side, the other swing is going on towards Jansenism. Jansenism is this uber scrupulous, crazy moralistic spirituality. And it's this fire and brimstone beyond any kind of puritanical fire and brimstone. It's literally taking the beauty of the Catholic faith and then twisting it up to make people even more scared. In other words, there is a distinction between venial and mortal sin. And mortal sin, you might not know if you're in. So think about that for a minute. So you should probably go to confession way more than you receive the Eucharist, just in case, because you don't know. So these are the kinds of things that are in this culture of Jansenism and in that particular area. And so St. Therese's parents were raised in that same milieu. And Zelly Martin was so repressed, let's say innocent and pure, that when she got married, she literally didn't know how procreation worked. So her husband, Louis Martin, who wanted to be a priest but ended up getting married, had to explain the biology of procreation to his newlywed wife on their wedding day. She was in tears, and so couldn't go through with it. And so the marriage was not consummated immediately, and then they took it to prayer and started talking about it. And then Louis, who was also very Jansenistic and also thought that he was supposed to be celibate, has an idea. He tells Zelly, well, why don't we be a Josephite marriage? A Josephite marriage is a marriage in the church, but there's permission to remain celibate within the marriage. And so this was like a great opportunity for Louis, who wanted to be a priest in the first place. And Zelly wanted to avoid the horrors of procreation, so she was all for it. And then this went on for a few months, and then eventually the desire for motherhood overtook her, and I would imagine the desire for the consummate married life overtook dear Louis. And so we have the Martin children that have entered into the world. But this is this environment. Now, scrupulosity is an intense form of anxiety disorder. It's an obsessive compulsive form, and it is it's horrifying. And when you add in the spiritual life and you add in that transcendent nature, that capacity that we all have to go beyond this time and place, that's that transcendent capacity that we have. And then you tie that in with psychopathology. It's like you just robbed your psychopathology of the opportunity for healing in normal means. Think about that for a minute. Like our capacity for spiritual growth, which is beyond this time and place, is twisted and inverted, and now that's the fuel to throw on the fire of psychopathology. So this is very difficult. In our work that we do, it's one of the most difficult things that we can treat. And this is rampant in this, oops. Oh, sorry, don't be sorry. So this is the emotional environment. We have Louis and Zelly Martin. They're already crazy anxious about everything, scrupulous, and then now we add into the mix that they have difficulty with childbearing, and she has a number of miscarriages. And then when they do bring children to term, then they also actually lose a couple babies after birth. So these two are just getting hammered by life. And then this is the environment in which Therese is born. Now, Therese has already lost, I think, 2 brothers to infant death at that point before that. And so her mother, she's being gestated now in a uterine environment that we understand now, the role of cortisol and what that does to neural development. And so Therese is already being ramped up for something really crazy. And then she's born to a mother who's still deathly afraid of death of her child. Like a lot of women who have had miscarriages will suffer that until birth. And then it's like, now I can breathe a sigh of relief. That didn't happen. And there was so much anxiety in that environment that then she couldn't nurse. Therese couldn't nurse from her mother, so she had to get a wet nurse. So Therese is born to an anxious mom who can't have a maternal connection. If you know attachment theory, you've heard of that before. The mother-child relationship builds neural pathways for emotional regulation. That's robbed. Then she's sent away from mom, literally, to a wet nurse for a year. And then she's pulled back home. So the woman that she develops a maternal relationship with is now taken away from her. And now Zelly is still really anxious with her, doesn't know how to really mother her. And now Therese is suffering from that. Her mom then dies of breast cancer. So literal death. Then she's given her sister, an older sister, who takes her under her wing, and she says, now you're going to be my daughter, I'm your new mama. And then her older sister goes into the Carmel, becomes a Carmelite, and she leaves her abandoned once again. I mean, this is like hit after hit after hit after hit. Now, let's back up a second. First of all, we have Zelly Martin, who is just ridden with anxiety, like severe psychopathology, admissible psychiatric issues. Then we have Louis Martin, who's just along for the ride in some ways and ends up with dementia. And after Therese had entered the convent, he suffered very severe dementia and died with a lot of shame and shame on the whole family, really, because of his behaviors and everything at the end of his life. They're saints. This is Saint Louis and Saint Zélie Martin. These are saints of our church. And this is not some glory story of like, well, the old sordid past, and then there was this conversion, and then they just, went and built hospitals all over the world. No, this is how Zélie died. This is how Louis died. Then you have Therese, who was literally catatonic. In the story of the soul, she talks about lying on the ground, shaking in seizures and convulsions. She had like weird psychological, all sorts of issues that we read through this now with this lens, and you're like, oh yeah, this is like any patient in the hospital. She would have and should have been admitted to psychiatric care if there was proper psychiatric care. And yet she is a not only saint, a doctor of the church. Now, she did have a grace that brought her to a place of peace, and her life is a life of having responded to this particular context. But what I want to make clear, and why I'm sharing these stories with you, is because it's not so simple. When we talk about the integration of mental health and our faith and our path to holiness, it's not like, well, if you're depressed, you're not holy enough. If you're anxious, you're not holy enough. And there's just more prayers you have to do, or you didn't figure this out, or you didn't do that right. Therese had not a mortal sin in her soul. She never once committed a mortal sin in her life. She was not living an unvirtuous lifestyle. That wasn't the reason for her anxiety, and more virtue wouldn't have taken it away, nor did it take away Louis or Zélie's anxieties or difficulties in their life. So I'm not here to say I have all the answers about what is and is not all mental health and all spiritual health. What I'm saying is it's not as simple as we think. That's the normal sort of cultural way that we think about it. So what is our job? What is holiness then? And this is where we can realize that there are two different kinds of suffering. This is the way I like to think about this. There's suffering that's out of your hands, and there's suffering that you could do something about. And so this is how we can have a both and. We can talk about how I wrote a book called The Mindful Catholic, and I integrated the spirituality of abandonment to divine providence with the psychological protocol called mindfulness-based stress reduction. It's an 8-week protocol that's been proven by thousands of studies to have significant psychological effect in reducing anxiety, depression, chronic pain, all sorts of other issues. And so I saw in that an opportunity to say, well, if this works, why does it work? And how can we overlap this with our faith? And actually, we already have it in our faith. It's called abandonment to divine providence. But the problem is that was written at a time when people didn't have a need for the experiential explanation of things, which we do now have postmodern world. So if we can put the abandonment to divine providence into terminology that makes sense of man of today, then we can probably help people. And that's what the Mindful Catholic is all about. So there is a way, and then I write that, and of course then people are like, so you're just saying that we can like put in, more mindfulness practice and then we take away all of our suffering. That's not Catholic. It's like, well, no, I'm not saying we can take away all suffering, but we can point to two different kinds of suffering. And there's the suffering that's outside of our hands, and then there's suffering that we can do something about. And part of the suffering that we can do something about is accepting the fact that there's some suffering that we can't do anything about. And in fact, that's like one of the core tenets of the mindfulness-based stress protocol is acceptance. And that we are changing our brain state from avoidance, where we think that there's a problem that we have to solve, we have to put out fires, and this goes back to, you know, do I like myself enough when I'm looking in the mirror? Am I going to get a good enough job? Am I going to have a meaningful enough life? All those problems that we think we have to solve all the time, towards acceptance of the present moment. And this is where abandonment to divine providence comes in, because the whole thing is about the present moment. So when we're presented with your reality, it's an invitation. Every single present moment is an invitation. Right now is a moment of an invitation. And the question that God is asking you right now is, do you accept what I'm giving you right now? Do you trust me? Do you know that I'm your Father who loves you? What is that moment? What does that mean? Maybe you're anxious. Do you trust me? Maybe you just broke up with somebody. Do you trust me? Maybe you failed something. Do you trust me? And so it could be biological. Do you have cancer? Do you trust me? And it could be psychological. Do you have some anxiety disorder? Do you trust me? It could be financial. It could be academic. It could be family situations that are going on. Do you trust me? Every moment is an invitation. Now, when we trust God and we say yes, and then we look to follow His will and find His way through that moment to grow and develop, we will be giving ourselves the best shot to have the least minimal amount of suffering necessary. Does that make sense? That will absolutely and necessarily include suffering. And in fact, this is very meta, because then the next level is like, well, what if I'm not good enough at that yet? That's added suffering. So you can learn how to accept the fact that you're not good at accepting stuff. And this is like, really, you could get lost in this. Don't think too long on it, because then you're wasting time. But if you turn your attention towards the present moment, you realize even your own perception of yourself and your own ability, your own prayer life, your own virtue, your own, how good of a friend are you? How good are you at anything? There's always that opportunity to ask that question, to answer that question. Do you trust me? Do you accept this current state of what's going on? And this is, if you're familiar with Viktor Frankl and Man's Search for Meaning, this is deeply embedded in logotherapy and what he says. So I'll read to you a quote from Man's Search for Meaning. Now, if you're not familiar, he was a psychologist who was in Austria and then taken into the concentration camps. He ended up at Auschwitz and has written about his account, the most intense, descriptive writing about the suffering that happened on a day-to-day basis. And as a psychologist, was like super aware and very curious about what he was observing in terms of human behavior pushed to the furthest extremes of suffering and torture. And so it's a really engaging read, first of all, but second of all, it teaches us so much about our human capacity and what we're really here for, even without getting into like religious terms. But he's talking about what Giussani calls the religious sense in so many different ways here. And it's like it's built into us, and people who are tapped into that are the ones who actually survived the concentration camps. And he was with others. There would be people who were kind of not thriving, that's the wrong word, but not dying. And they would kind of try to help others who are on that brink. And so what he said was, what was really needed was a fundamental change in our attitude toward life. We had to learn ourselves, and furthermore, we had to teach the despairing men that it did not really matter what we expected from life, but rather what life expected from us. We needed to stop asking about the meaning of life, and instead to think of ourselves as those who were being questioned by life, daily and hourly. Our answer must consist not in talk and meditation, but in right action and right conduct. Life ultimately means taking the responsibility to find the right answer to its problems and to fulfill the tasks which it constantly sets for each individual. So pushed to the extreme, in the most dire circumstances, we get the fruit of that really at each of our tasks now in our comfort. And so many opportunities to get lazy or to forget what we're supposed to be here to figure out. And that's it. And it doesn't have to be a concentration camp. It's every circumstance of our lives. Sometimes our lives feel like maybe that's where we're at. And it's those moments, or it's just the boredom sometimes. That's the moment. Or, again, the relationship or the family stuff or whatever it is. It's every one of those is God's invitation to you to answer that question. What is life asking of you? All right, so I want to just give you guys whatever I can. So, and of all the stuff I've said about what I've done, what I'm working on, what I've developed, what are your questions? Sorry, hold on. Do you want to get a mic? Thank you.
Hello.
Great, you're good.
Okay, cool. Okay, yeah, thank you so much for speaking to us today. It was super cool. So I guess one question. So you mentioned that you spent some time with the Franciscan Friars, which is awesome. And I was just really curious if there's anything that you learned during your time as one of the brothers in the Bronx that you took with you into your field of psychology.
Oh, so many things. But, I really, it was a time of my life where I learned how to pray and I learned how to discern. So, when I joined the Friars, I was, doing everything right. I was super excited. I was living virtuously. I was doing all the right things. I had gave away all my stuff. I was happy. All my, my friend. I had the best group of friends that were good, holy people, and it's this is it. And I didn't realize how internally I actually was so blocked from hearing God's real call to me. And so what I realized through this experience was our experience has to be reverenced, and that there's development that happens. And so people are like, oh, do you regret that you spent that time there, or do you feel like you made a mistake, or was it hard to leave? And I mean, it was hard to leave, but not because I thought it was a mistake. I actually really felt very clearly that I was doing the right thing. And the way that I make sense of it now is that, I tell people your vocation is what's at the bottom of your heart when you look down into your heart, and God will give you your vocation in the depths of your own being. So people are seeking well, God will tell me what to do. No, he's not going to tell you from outside what to do. He tells us from inside what to do. And so if we look inward and we learn how to listen and we learn how to pray, we can discover what God is calling us to. Well, what I realized was when I was looking down into my heart, I saw my vocation. I thought I was looking at the bottom. It wasn't really the bottom. It was a false bottom. And it was through more prayer and more time in the Friars and then direction from Father Benedict Rochelle and just maturing, that all of a sudden the bottom, cracks started to open up in the floor, and I could see light actually shine. This is my image in my prayer. I could see light shining up from the bottom. And then little by little, all of a sudden the bottom actually just disintegrated like something out of Indiana Jones. And then I just realized there's a whole nother bottom. And then at the bottom of the bottom was the treasure chest, and it was shining forth of the glory of my actual vocation. And it was so beautiful. And so that taught me, number one, be patient with ourselves. We're doing the best we can. Number two, we're never going to have all the answers. So it's really stupid to think that we have all the answers. And number three, if we trust God, he will walk us towards where he needs us to be when he needs us to be there. And so that was really I would say if I could boil down the most important thing that I take with me now into my life, that's a daily reality that I try to live out.
One of our online viewers asks, how would you recommend supporting someone, spouse or close friend, with a mental illness? What role can you play in their faith and mental health journeys?
Yeah, beautiful question. I think we're all supposed to play a part in all of our journeys, like wherever that comes up. So first of all, and this is why we're doing what we're doing with our certification, and we're going to be working on doing sort of lower levels or lesser levels of intensity to even do some kind of like first aid trainings type thing. But the core nutshell of it is just like there's, accompanying other people is such a graced and privileged and blessed responsibility and invitation. And so there's a really good book by Father Adrian Van Kam called The Art of Existential Counseling, and he talks about this in here, but it's being present in a way that you're fully with the other person. Anybody with a mental health like symptom or issue or a cry for help, it's more than just saying, I feel so depressed or I feel so anxious, I need help. Underneath that is somebody saying, will you be present with me? Will you see me? Will you be with me? Will you be with me? With your presence, with your whole person. And one of the first things that we train people out of in the field of mental health, if you are licensed, is like getting over this like savior complex where it's like, here I am, I'm the therapist, I'm gonna fix you, and it's like, no, I give all the glory to God. It's like, there's so much in us that's like, I'm gonna be the one to help you. And then it becomes very clear when you can't help somebody, like how devastated you are that you didn't do the helping. So we work through a lot of that stuff. The point being, when somebody is actually close to suffering, what every single one of us needs, regardless of diagnosis, is presence. And so just being with, but in a way that's really with. So like leaving your own preconceived notions, your own experience, your own stuff aside. If you're going to really answer that call to be with somebody, it means that you're really entering into their experience with them. And that is enough. That actually is enough. When you're there and then you start to feel like, okay, this person might be in danger or really does need extra help, of course, we want to make referrals, get somebody else involved. Maybe you talk to somebody and find out, like, what can we do? But that initial being with is always the most important step.
Hi, how are you? My name is John. I was a graduate of Princeton. Now I'm an employee here. I was just wondering if you could talk a little bit about medication. What should Catholics' orientation be towards medication? And I guess my second question is, usually the standard approach in psychology is medication in cooperation with therapy. Often the medication's used to, I guess, for example, in the case of anxiety, to get the alarms down so that the therapy can do the actual work. Do you think that two-pronged approach is beneficial? Should it be more like a three-pronged approach, like adding faith, or what would you recommend?
Yes. Definitely add faith, 100%. Anytime that's possible. And when we're walking with people, that being with, again, what I just said, is you're really entering into that person. So people say, like, do you work with non-Catholics? Yes, we work with non-Catholics. We work with anybody. We work with Catholics who have lost their faith, which is more common than you might expect. People coming to CatholicPsych Institute, but they actually are wrestling with their faith. So we're not going to lead with faith. We're going to really enter into wherever they are. But our model, our foundation, our blueprint of anthropology is built on a faith-integrated model. So that's one piece of it. In terms of medication, so I'm going to give you the standard answer, and then I'm going to tell you my thoughts. The catechism answer and the true answer is that, of course, we are open to science, and we are benefiting from technology and science and the advances of medicine 100%. We should always be open to that and utilizing those interventions as appropriate, which in our current societal milieu and the driving factors behind the medication in actuality is not often appropriate. So this is where it helps to have a PsyD and have some credentials behind me to say this, because I hear people talking about this if it's, in other faith, if it's like Catholic answers or different things like this, it's like, well, we got to give the catechism answer. It's like, that is the catechism answer, that of course we're open to science. But there's a significant place of criticism to hold as well. And so what ends up happening is, biologically, all the medications for the most part are suppressing symptoms. And so there are much deeper things. When you say like to put down the alarms and all that, yes, theoretically that's what they should be doing. Nobody's using it that way. It becomes much easier that the prescribers they know how to write the prescriptions, and they know where the pharmacology comes in. They know the drug industry. And there's a lot of the drugs happening without the deeper work being prioritized. And so this is just practically what's happening right now. So it's like, it's a really tough spot to be in, because on one hand, you can't say, and I wouldn't say anything negative about medication per se, but when you really get into it with a person and you're like, all right, let's look at what's happening in this case. Okay, you started at this milligram prescription, and then it just increased over the last 3 years. That's interesting. Why did it increase over the last 3 years? Well, because there's drug tolerance. Well, okay, so but as you were increasing your dosage, what were you doing? Because supposedly you were just taking a short break to reduce symptoms so that you could really do the real work. That turned into 3 years of increasing prescriptions because of drug tolerance. And then, so who's actually looking at that? That's not what's happening. So I get very cautious around this, and if we're saying two-prong approach, or in best case three-prong approach, that therapeutic accompaniment prong needs to be primary, and somebody really owning that and really committing to walking that with somebody. And then it is important, and it is healthy. And it's sometimes the biological dysregulation is at the point where it's very helpful to have some medication mitigate that.
Thank you so much. My name is Meredith. My question is, when do you feel like therapy is like the right tool for the job? Insofar as like we all have suffering and we are all called to the ministry of accompaniment. So we all have there's different resources. There's friends, there's spouses, there's priests, there's your sister, your mom, whatever. There's all these people to talk to. I'm curious, do you think that everyone would benefit from having a therapist, or are there certain situations in which that is the right fit? This is a little bit of an anecdote, but I had to reschedule a meeting because I was in a dispute with my landlord about something that had kind of escalated. So with a professor, I had to reschedule this meeting, and I was apologetic in the email, and she just sent me back a referral link to the student counseling. She was like, "You sound really stressed, just to let you know." I was like, I just am trying not to get evicted. That's kind of the issue more so than, that is an instance where maybe that was not a tenant rights lawyer might have been the better tool for that situation. Though I appreciated her effort to empathize. But I'm curious on your thoughts for when do you feel how to discern if you're struggling with something, if it's just something that you should kind of deal with through prayer or a spiritual director and just kind of talk to about your friends, or when to know if it's the right time to have that kind of relationship, or should everyone have that relationship almost preemptively? It's kind of, I think, once there's already a crisis and then you reach out to a therapist to establish care, it's how much can be accomplished in the first 60-minute session versus if that's already a relationship. So I'm just curious, how does therapy fit into the broader set of resources to deal?
Yeah, no, it's a great question. I think again, circumstantially, I think my answer is going to be similar to what Teresa Avila would say about spiritual direction, and that she, goes on and on and on about how important it is and how good it is and how everybody needs a spiritual director, and then she warns us how difficult it actually is to find a good one and how much more detrimental it is to find a bad one. And so it's exactly the same thing with mental health. And in fact, there's a lot more overlap than difference between spiritual direction and mental health. And so the real issue is, who is it that you're going to? Because just finding a therapist is such a difficult task already. So I can't really say it's better always to have one. Now, if you have somebody who's good, who understands integration, who understands mentorship, who understands accompaniment, who understands spiritual direction, who understands therapeutic intervention in that way, how could that be bad for somebody? That's always going to be good to have somebody you can talk to like that. Now, that person might not always have a degree or a license. And it could be a grandma, and it could be a friend, and it could be, somebody. It's usually somebody that's lived a little bit more life and has more wisdom if it's a natural kind of skill set they've developed. But it's always good to have people that are really seeing us and accompanying us and walking with us. So again, when you get into the nitty-gritty of the mental health field right now and the actual people who are out there as therapists, it's few and far between that I would say there's a person that anybody would benefit going to anytime. So it's a little bit of a both and answer, but that's what I would say.
Thank you. My name is Jackie.
Hi.
And I wanted to return to the topic of helping others with mental health. And I was wondering if you think there is spiritual help that can be offered to people who don't really have a religious life. Because I think for me, what has been very helpful in difficult moments is falling back to God. But people who don't have that and kind of feel helpless, how do you help them spiritually?
So how to walk with people or help people that don't have a spiritual life?
If you think there's any spiritual resources that they could use, although they don't really believe in God.
Yeah, I guess it's a good question, and it's a tough question to answer because everybody's going to have their own particular flavor of why they don't have a spiritual life. And there's people that are resistant to it. There's people that are hurt by it. There's people that are just ignorant of it, that it was never given to them. So it really depends on the angle at which you're coming with a person who doesn't have that framework. And I would say the underlying principle, which I would hold on to, is that all of us are made for eternity with the transcendent. And it's written in our hearts. You cannot be human and not have a heart that is made that way. It's the only way to be human. So just like somebody might not know the nutritional value of all the food they eat, it's still going to matter what they're eating. So how do you this is part of that walking with. That's part of that mentorship and or accompaniment, and it's like, to the level at which you can really enter into that person's world and experientially know why they are resistant to what you can assume they're made for. And then you figure out what angles might be there, and it might be something totally, it could be something that's related to the community of humanity. It's like, let's go do some volunteer work, and you just end up going to the soup kitchen with them. Or it could be somebody that's super cerebral and intellectual and academic, and you want to figure out an angle to get to the transcendent around the specific religious, and maybe you're bringing in some philosophy, or you're digging into some other things, or it could be very emotional, where there's wounds that they don't want to go down that road, and then that's much more of just an emotional support, being with somebody, and then praying and hoping that your witness being with them, if you're known to be a person of faith and you're able to provide that emotional support, sometimes that's all that matters. Which is, if you think about it, really, I think that's where the enemy can actually use that principle and twist it. Which is why you find people that are so off the mark. You know, when kids are taken apart and you know, misled into all these different directions, a lot of times it's because you just have people in those other communities that are just like, I'll listen to your problems. What did your parents do to you? Like, oh, that's terrible. You know, they're just like walking with them. And it's like, they're not trying to convince them of anything at that point, but it's because they are seeing them. And the kids are so unseen that just to be seen. And then all of a sudden it's like, oh, you're the one who sees me. What do you think? What do you believe? And that conversation ends up happening down the road. So sometimes it's just being emotionally present in that way and then waiting for the right step. But know and keep it in your mind and heart that that's what they're made for. You know, and you can pray into that as well. You know, it's like ask for the graces to come through your words, through the moments that you have together. I remember, you know, just moments where it's just like praying, being with somebody, and then all of a sudden, like, a third party enters the conversation or comes into the picture and, like, asks the questions that start the conversation that you couldn't have had with the other person in a million years. But it's like you're talking to this person and then you know that they're listening. You know, like, stuff like that happens. So the intention is to be with and to really go in. Like, that's the focal point. But then you can look for other ways that come up along the way. Is that helpful? Okay.
Can you talk about the ways in which your work has impacted the way in which you raised your children?
Oh, good question. Definitely. Yeah. So I can be a real jerk. So that's really not good for parenting or being a husband. You know, I've learned how to sit with discomfort because of my work very intentionally. One of the sort of components of mindfulness is to sit with discomfort instead of, it's like, here's a fire, I feel like I need to put it out, but I'm going to just let it be there for a minute and observe it and just let it be there, and then realize, like, I have more to me than an animal nature that just needs to react to stuff. So I'd say that that's been really helpful. I do a lot of work with gender and understanding brain differences between men and women. And so I grew up with brothers. I never had any sisters. And when, you know, getting married was different for me. And then having daughters was new. So my firstborn is a boy, and that was easy for me. And then my secondborn was a daughter. That was very hard. So I remember one time sitting at a dinner table, and Francesca, my second, was probably 3, and she had reached across to grab something off my plate, and I just, like, grabbed her hand, and I was like, no, we're not doing that. And then, but it was like with a little sternness to it, and she melted. Her face fell apart, and she's just bawling. I'm like horrified. I'm like, oh. And then I just look at my wife, and she's like, you can't talk to her like that. She's a girl. You know, it's like if it was Elijah, my firstborn, he would have, like, slapped me back or something, you know. But I was like, oh wow, like, this is totally different. My facial expression, my eye contact, my gaze, like, my tone, everything means different things for her. And so I think because of my work, like, really trying to study this stuff, I think I learned that lesson a lot quicker than if I had to just keep on suffering that pain over and over and over again. So yeah, little ways that interpersonally that it's helped me.
Hey, my name is Mihao. And so just for background context for the question I'm about to ask, I'm Catholic, but I feel like I'm currently in the stage of kind of wrestling with my faith a little bit. So it's really beautiful to hear about, like, finding truth and finding a spiritual director, and how, like, living a Catholic life aligns with all these psychological studies about living a mindful life and letting go of anxiety. But is that the only path towards reaping, like, those benefits of living a mindful life? And this is said with the context of, so I lived in a Buddhist monastery in Tibet for a while, and there, if I talked to any of the 500 other monks that I lived with for a while, like they would also say that like letting go of anxiety and living a very mindful present life was found through Buddhism for them.
Sure.
So I guess my question is like, why are you not Buddhist and why are you Catholic?
That's a great question. I really appreciate that, and have great reverence for the Buddhist practice and for where you're at in your journey. It's so important. It takes such great courage to own that search, and it takes even more courage to just put it into a microphone and say it publicly like that. So really, really grateful for that. And it's we look at developmental phases really quick. You have to go through individuation through adolescence and into young adulthood, and people that don't suffer greatly later in life. And when the people are courageous enough and they've had enough, I assume, validation on a human level of who they are, that they can embrace the sometimes terror of that searching, then you're going to be rewarded for that for your whole life. And that's what we look at studies with, like midlife crisis, and people who don't resolve the issues now have a really bad midlife crisis. People who don't resolve them at 40 or 45 end up re-experiencing another crisis at 50 or 55. So this is going to plague people until they finally get that deep sense of individuation and really own their faith. Now, really good question about Buddhism. And so 2 things to this. Because of integration, you can do a lot of the right things and have a lot of the right effects. So, and this is where we give a lot of credit to the Buddhists, because they don't have a spiritual life to fall back to that's superficial or externalized. And when we have a spiritual life outside of ourselves, it can become superficial and externalized. So in other words, if you read Abandonment to Divine Providence, it's a beautiful spiritual book. And then you read the book and you're like, oh yeah, I got it. This is totally right. Just abandon and trustful surrender in the present moment, and this is it. Like, I read it and I can do it, and now I'm doing it. Look at me, I'm doing it. And you're like, I'm holy now, right, God? And then people, and then just go on their way. And then they're like, screaming at somebody or evicting people out of their apartment or whatever. Sorry, she left. But because the Buddhists don't have that kind of stuff, it's like they've had to go very, very deep at understanding their own psychology. Like, that's all they have. And so they've created this articulation of the workings of the human mind that is light years beyond what we really have experientially. So obviously we have a beautiful philosophy of the person, but what they are experiencing something different. And then they're talking about it and articulating it and helping other people experience it. So that's all good and well and good and beautiful, and it's human. And they're experiencing something that's true and real about human psychology, because they're human and we're human. So as we believe, they're made in the image of God in a certain way that follows a blueprint that I am too. So like we can look at the same, like if we all put our hands in hot water, we're all going to feel hot temperature. So, and another side note, some people had criticisms about Catholic mindfulness because they said that it's like a spirituality that's Buddhist. And I was saying, like, it's actually not even spirituality in the first place. Mindfulness is actually just really good psychology. It's just the cognitive dimension of psychology. It's just what you're doing in your mind. So if you do Sudoku exercises or crossword puzzles to work on different parts of your thinking, you can do mindfulness exercises to work on other parts of your thinking. It doesn't have to be spiritual at all. Now, what we break down, and this is an appendix in my book, or I really open this up, is that the critical difference is in the worldview that justifies the practice. So in other words, and this is where the mystery of the Catholic revelation becomes really important. So, and this is with all due respect to the Buddhist mindset, and this is how I interpret it. So, I might be wrong, and I could, hopefully not, but I could be offensive in saying this. And I've said this to Buddhists, and they didn't take offense to it. So at least those two. But when there's an experience of unification internally, and we experience our connectedness to all being, we are experiencing a very true and real dimension of our ontological, metaphysical world. Because this world is made in the image of God. And God is the Trinitarian mystery. And God is one, and God is three. And we forget that. And when we hear the Buddhists talk about all is one, well, that's so crazy. Buddhists think all is one. It's like, actually, it's not crazy at all. We believe that. We believe the world is made in the image of God, who is one. So there is a oneness to the created order of the world. And we, as Catholics, hold mystery. So we can say it is both one and three. And we would say the world is created with diversity or multiplicity. So what happens is the Buddhists have gone so deep into the experience of self that they've actually passed the self, and then they actually experience this connection that we all have the capacity to, of awareness of the unity of the created order. And this is where they've realized there's this connection to all the world. And they say, oh, now we've gone beyond the Maya. This is past the illusion of self. Now this is true. This is what's real. That sense that you have that you're individual and different from everybody else is an illusion. This is enlightenment now. We've now gone to the place of true enlightenment. And what we would say respectfully is, no, your consequence to your argument is wrong. Because of the mystery of the Trinity, we can believe that it is true that you experience something that's real in the oneness of the world, but it's also still true that you exist as an individual self, and that there is a dimension of multiplicity of being in this material world and in the created order. So that's a fundamentally very important difference. And I tell people this more simplistically. They'll say, like, well, I say, like, do mindfulness. Like, mindfulness is great. Be careful. You have to know the background to the practitioner of mindfulness. So when you're on YouTube and you're looking for exercises to practice, there's a difference between pay attention to the feeling of the breath going in and out of your lungs and now realize that you are not real. It's like, I think we went off track there for a minute. I'm not sure where he's going with this, but, it's like that's not mindfulness anymore. That's philosophy. That's metaphysics. And respectfully, but it's not mindfulness. The mindfulness is the path towards discovering enlightenment in which you are one with everything and the self is an illusion. Does that make mindfulness wrong? No. The Eightfold Path to Enlightenment also includes right action and right speech, things that we would call virtue. And so the Buddhist teaching on right speech is out of a Aquinas playbook. They're saying the same exact things. Don't lie. Speak kindly of others. Don't make up stories about people. Like, you read the Buddhist path to enlightenment includes right action and right speech. And I mean, you know this already. I'm saying this for other people's benefit. But so it's not wrong that it's mindfulness because it's on the path to enlightenment. But that final step of like that ultimate justification, which says, and now you realize that you are not real. It's like, all right, we're not going to go that far with it. And so that would be the underpinning. And so I think that there's a lot we can take from that and realizing we actually need more unity in our world, especially in the humanity section of the world. The community that we have and what we actually share in the church teaches in solidarity is that we're supposed to really live as if we're part of something bigger than ourselves with other people. And we don't get that enough. So I think we need more of that. But we don't need to also ditch being a true self.
Thank you.
All right. Thank you.